Did you know that consuming too much spinach can cause dizziness, irregular heartbeat, blood sugar drop, hair loss, depression, diarrhea, and some other diseases? Think well. Which one have you ever experienced? Stay with me to get answers to your questions. Spinach is a healthy food that is useful for all people, be it an athlete, a child, or an adult human being. But you should also pay attention to the harm of consuming it too much so as not to harm your health. Do you have experience of illness caused by eating spinach to share with us? Let's check together some examples of the side effects of spinach: irregular heartbeat, hair loss, and depression. The iron in spinach increases the production of red blood cells in the body and helps to treat iron-induced anemia. This blood disorder causes symptoms such as fatigue, weakness, irregular heartbeat, shortness of breath, dizziness, and chest pain. Eat spinach in moderation. Excessive iron causes symptoms such as chronic fatigue, joint pain, abdominal pain, irregular heartbeat, hair loss, depression, and high blood sugar. Diarrhea, constipation, and intestinal obstruction. 1 cup of spinach contains about 6 grams of dietary fiber, which has many benefits such as improving bowel movements, eliminating constipation and digestive problems, reducing cholesterol levels, eliminating toxins, regulating blood sugar, etc. However, it should be avoided in excess because the high level of dietary fibers can cause problems such as abdominal cramps, diarrhea, malabsorption, constipation, intestinal gas, intestinal obstruction, etc. Before continuing the video, please like the video and leave your comments at the end. To see more videos, please subscribe to the channel. Blood sugar drop in diabetics. Spinach has a low glycemic index of 15 and reduces the rate of sugar release in the bloodstream. It prevents the sudden increase in blood sugar levels and is also effective in controlling diabetes. However, eat spinach in moderation because consuming too much of it may lower blood sugar levels abnormally. On the other hand, it can cause tremors, dizziness, excessive sweating, excessive hunger, fast heart rate, confusion, and irritability or moodiness. If you are taking diabetes medication, eat spinach after consulting your doctor to reduce the risk of drug intolerance. Kidney diseases. Spinach contains oxalate, an organic acid that is excreted from the body through feces or urine. However, in excessive amounts, the kidneys cannot filter it properly. They may bind with essential nutrients such as zinc, calcium, magnesium, etc., which ultimately leads to poor absorption of these nutrients by the body. It also increases the risk of mineral deficiencies. Also, when spinach is consumed in excess, the high concentration of oxalate may cause damage to the kidneys. In high concentrations, the oxalate in spinach binds to calcium in the body and forms calcium oxalate, one of the common causes of kidney stones. If you liked the video, like it and share it with others.